Atrial fibrillation is the most common rhythm disorder seen in clinical practice. Probably upwards of 6 or 7 million people in the United States right now have atrial fibrillation, and we add about 1 million new patients a year who have atrial fibrillation. Atrial fibrillation is basically kind of a chaotic rhythm of the upper chambers of the heart. They're not contracting synchronously, the atria, and it causes the ventricles to have kind of either an irregular pulse or a fast pulse rate. Atrial fibrillation manifests with a couple of clinical sequelae, which would be exercise intolerance, fatigue, shortness of breath with exercise, and importantly, it's also very highly associated with stroke. It's one of the most common causes of stroke around the world. It's also a common cause of heart failure and early mortality. And atrial fibrillation is usually a consequence of something else going on in the body. There can be a genetic predisposition to atrial fibrillation, but most of the time it's because the left atrium heart chamber is under tension. That can be from a valve problem, that can be from hypertension, it can be from sleep apnea. Once atrial fibrillation is identified, that should trigger an evaluation with the cardiologist to say, why am I having atrial fibrillation? Why did this happen to me? Sometimes it can be corrected, especially when caught early, just with medicines changes, treating hypertension and things like that. But most often, by the time that it's clinically manifest, patients are going to need something more than medications. And if medications don't do the trick, patients are offered some sort of treatment to kind of figure out where that abnormal voltage is happening in the atrium, and most often that is going to be a catheter treatment through the groin that can treat a very common site of the initiation of atrial fibrillation. Persistent atrial fibrillation is when AFib is your rhythm, okay? And that is usually associated also with exercise intolerance, fatigue, and a real impact on quality of life. But again, as with all atrial fibrillation, if you have it, you're not going to live as long as other folks, and the cause of that is multifactorial. So most often we treat AFib because of symptoms. We actually did just see some important data released earlier this year that shows that treating atrial fibrillation and restoring rhythm can actually impact and possibly reverse that survival disparity. But we now have access to a special minimally invasive hybrid treatment here at Vassar, where we tag team an approach between the heart surgeon and the electrophysiologist. We're using a video approach to the outside of the left atrium. We're able to treat some of those abnormal areas of electricity from the outside, while the electrophysiologist treats the normal, kind of the typical areas that you can get to with a catheter. And with this 1-2 punch, we're able to restore normal rhythm a little over 80% of the time. It's a special procedure called convergent. We also call it hybrid ablation, and it's also pretty new, and it's not being done at too many places in the United States, so we're very fortunate to have it here.